Second white coat. Subscribe and like. Let's learn medicine together.
Welcome to The Explainer. Today, we're going to dive into a pretty fascinating medical mystery. How can a treatment for Parkinson's disease that works perfectly for a decade suddenly start to backfire? And, more importantly, what does the amazing solution tell us about the future of brain surgery?
So, let's start with a puzzle. Imagine a 64-year-old man with Parkinson's. For 10 years, he's been managing his symptoms pretty well with a standard medication, levodopa. You could say it was his lifeline, really.
But lately, something's gone wrong. That exact same medication has started to, well, betray him. It's causing these awful side effects, uncontrollable movements, even moments where he's just frozen in place. He's completely stuck. The very thing that was giving him freedom is now part of the problem.
And that brings us to the big questions, right? What on earth has changed inside his brain to cause this? And is there anything at all that we can do to fix it?
So let's get into what this frustrating situation actually looks like. I mean, for a lot of people with advanced Parkinson's, it's just this constant, daily struggle.
And this quote from the patient, wow, it just says it all, doesn't it? The pills can work, but that relief comes at a huge cost. It creates a whole new kind of prison for him.
Okay, so his daily life is basically dominated by three massive problems. First, these freezing episodes where he just suddenly can't move. It's got to be so frustrating. Second, his medication wears off way too fast, so his symptoms come roaring back before he can take his next dose. And third, right after he takes his pills, he gets these involuntary writhing movements called dyskinesias, just totally out of his control.
To really get what's going wrong here, we have to take a step back and look at how the brain is supposed to work. And when it comes to movement, it really is all about balance.
So deep inside your brain, there's this area called the basal ganglia, and you can think of it like a really simple switch for movement. You've got a go pathway that gives you the green light to move, and a no-go pathway that, you guessed it, hits the brakes.
And what's the one thing that keeps this whole system in perfect sync? It's a chemical called dopamine. Think of it like a master conductor of an orchestra, making sure the go and no-go signals are working together in perfect harmony. The result? Smooth, controlled movement.
Now here's the really clever part. Dopamine is basically a double agent for movement. It's doing two things at the exact same time. It's hitting the gas on the go pathway while slamming on the brakes for the no-go pathway. It's this powerful two-pronged attack to just make movement happen.
So if dopamine is our master conductor, what happens when the conductor just leaves the stage? Well, that is the fundamental problem in Parkinson's disease.
You see, in Parkinson's, the brain cells that are responsible for making dopamine start to die off, and this creates a serious shortage of our master conductor.
And without enough dopamine, that beautifully balanced system is thrown into absolute chaos. The go signal gets really weak, almost like a whisper. Meanwhile, the no-go signal starts screaming through a megaphone. It just becomes overwhelmingly strong. And this kicks off a really devastating chain reaction. That overactive no-go pathway puts two key brain regions, the STN and GPI, into total overdrive. They then just bombard the thalamus, which is like the brain's main relay station for movement, with stop signals. The thalamus basically gets shut down, so it can't give the final command to move. And the result of all that? All the classic symptoms of Parkinson's.
Okay, so this whole chain reaction is super complex. It's a total system failure. And that brings up a really important question for scientists.
If we can't just replace the dopamine that's been lost, is there a single critical point in this misfiring circuit that we can target? You know, a weak link in the chain that we could break to restore some kind of order? And the answer, incredibly, is yes. Researchers have zeroed in on one of those hyperactive regions we just mentioned, a tiny but super powerful area called the subthalamic nucleus, or STN. This is our target.
And that brings us to a truly remarkable surgical solution. Now that we've found our target, the STN, how in the world do we actually fix it?
The answer is this amazing technology called deep brain stimulation, or DBS. And honestly, the best way to think about it is as a pacemaker, but for your brain. A surgeon implants a super thin electrode right into that overactive STN, and it delivers these tiny, precise electrical pulses that basically just calm it down. So what the DBS does is it sets off a kind of reverse domino effect. By calming down that overactive STN, it also quiets down the next part of the chain, the GPI. That means the GPI sends way fewer stop signals to the thalamus.
And with the brakes taken off, the thalamus is now free to send the right go signals. And just like that, movement gets dramatically better.
But you might be wondering, okay, why the STN? Why not another part of that whole circuit? Well, that's a great question. While targeting another area, like the thalamus, can help with just tremor, it wouldn't fix our patient's biggest problems, the freezing and the medication wearing off. The STN is the perfect target because it addresses that whole range of motor issues he's dealing with.
So, when you boil it all down, it comes to this. For someone with advanced Parkinson's dealing with these wild fluctuations, DBS of the STN is this incredibly targeted solution. It works by reducing those stop signals, which leads to better movement. It's just a remarkably elegant solution to a very complex problem. And all of this leaves us with a final, kind of mind-blowing thought. We now have the technology to go into the brain and precisely tune a specific circuit to restore a lost function. It just makes you wonder, what's next? What other conditions, everything from depression to memory loss, could one day be treated by finding and fine-tuning the right circuit with a pacemaker for the brain?